We believe, and I'm not alone in this, that the airborne transmission of the virus has been grossly underestimated. And we are not just saying this with the benefit of hindsight. If you look at what was learned after the first coronavirus outbreak, which was the SARS outbreak early in the century, SARS-CoV. It should have been called SARS-CoV-1 because we were now talking of SARS-CoV-2, but you see what I mean, a sister or a cousin of the virus we've got now. And then there was the MERS outbreak, the Middle East respiratory syndrome. Again, virus is very, very closely related to this one. And the conclusions drawn from that by Public Health England, by the WHO, and so on, is that these were likely spread by inhalation, and that healthcare workers, even just looking after patients, never mind doing any fancy procedures, needed to have this protection. The HSC in 2008, to its benefit, to its credit, I should say, did research which showed that surgical masks will hardly stop the virus at all. You can always find the virus that's gone through, whereas FFPs will be much better, orders of magnitude better, and prevent this. The HSC had said in its guidance of 2013 or 2014, you should treat biological agents as being fine particles, and you should use the equivalent of an FFP3. So all this evidence was there, all the lessons had been learned, yet when the pandemic struck, all of a sudden we're told, we do not have absolute proof that the virus can be measured in air. We think you can get by with a surgical mask. And that is why we have now used this phrase, which will appear in the BMJ print edition on Saturday, rationing, rationalizing the rationing, trying to find reasons why you can sort of clamp down. Now, what really grates with me wasn't just that in the first wave, this happened because the country was unprepared in terms of stock, because many other countries were unprepared in terms of stock, not just this one. Let's concede that point. What really bugs me is that the country invested, as we heard earlier from Mr. Mirza, billions in buying PPE. They are sitting in thousands of containers in Felixstowe Dock and elsewhere. And if those had been mobilized for the second wave more widely, not just nurses, bus drivers, so on, then we would not have had the peak, in my judgment, that we have in fact had.
Mm-hmm.